this law is technically called Certificate of Need, but what does it do? What's it require?
That's right. So Certificate of Need laws were put in place a couple decades ago in an attempt to lower healthcare costs by limiting the supply of healthcare services that are provided. So what ends up happening is if you are a physician that wants to provide a new service or a existing facility that wants to expand, you would need to go to a state planning board and prove to them that there is a need to provide this service at levels higher than what is already being provided. You'd submit an application and the state would look at their data to see if they project a similar need, and then they would either grant access or deny access. So what ends up happening is you have government bureaucrats that are really deciding who can enter into the healthcare market, and that really has some adverse effect for a lot of consumers and providers.
What you found in your research, Jordan, and it's really interesting because you've been writing about this, and folks can read your blog in the locker room at johnlocke.org. You found that North Carolina was by far not the first state to do this, and certainly
That's
this
right.
has been going on for decades and decades and decades. Tell us about the history of con laws.
So what I found was that these Certificate of Need laws really came about in the as far back as the 1800s, and they were used to regulate businesses and industries like the railroads, public utilities, things like this. And they were implemented to try to reduce wasteful duplication of services back then and what people referred to as ruinous or bad competition.